Everyone. My name is Jason Oko. I will be your virtual host for this meeting. And we have Matt Scholl with us today to playing the role of Sam Hurley. Um, some ground rules for everybody. Everyone is muted in the meeting. You cannot unmute yourself. Please leave your video off so we can preserve some bandwidth. Please put your questions in the chat. That chat function is open for everyone to use right now as we speak. If you cannot use the chat and you want to send us a question, you can send us a text message. I have that open and running as well. The number to send that text message to is going to be 207-370-2072, 207-370-2072. And if you need it again later, we'll share it again. The meeting is being recorded. Later today, it should be available on the Maine EMS YouTube channel for everyone to watch again or to share with their friends. If you haven't done so already, consider liking our channel and subscribing so you can get notified every time we release some new content. So without further ado, I'll hand it over to Matt.
Thank you, Jason. Hello, everybody. My name is Matt Scholl. I'm the state medical director for Maine EMS. Director Hurley sends his hellos and his apologies for not being here. He is actually in the process of finalizing the final steps to his doctorate in public health, and asked if I would mind hosting for today, and I said yes. Please, as questions arise, use the chat function or the number on the screen. I want to start by saying thank you to everyone for continuing to participate in this venue. It's great to see 67 people in this today. If you have questions, I hope we can answer them all for you today. I want to also start by acknowledging that we continue to respond to this pandemic. I know that it's very stressful. I know that the response has been long. I know that everyone is weary. I know that things like the vaccine mandate have only added to the stress that everyone is experiencing. Please, as we've said in the past, look out for each other. Please take care of each other. Please support each other as we go through the response to the pandemic and all the other associated stressors that goes on. I remain convinced that we can do this. I remain convinced that we can do this together. And I remain convinced that we can be stronger at the end of this. I look back at what we've done so far and I marvel at the actions of you and your colleagues and how much you've done to maintain the safety of this state. And I know based on that, and that we can continue and we can persevere through this, but that we've got to do it together. And I appreciate everyone participating continually in this. I want to actually share some other slides, Jason, if that's okay with you. I'm going to just jump over and share some slides and just think out loud together a little bit about why our healthcare system is so busy. I know a few of you saw this just a few hours ago. Chris, Brad, Sally, I apologize, but I think this is helpful for all of us to understand and for all of us to actually consider. We've all been witness undoubtedly to increasing call volumes. We've all been witness undoubtedly to hospitals that are very busy. That changes our response patterns. It certainly changes our in some cases transferring patients longer distances, moving patients between hospitals. It's become tremendously stressful in the EMS system as well. And I thought it'd be interesting to look into this a little bit collectively together and think about this. To start off, it's important to have some baseline information. The American Hospital Association tells us that there are about 920,000 hospital beds throughout the US. Of these, there are 96,000 ICU beds, but about 22,000 of those are NICU beds, meaning they're exclusively for newborns. That leaves 68,000 adult ICU beds and about 5,000 pediatric or PICU beds. Those adult ICU beds are split between medical ICU, trauma ICU, surgical ICU, cardiac ICU, cardiothoracic surgery ICU, neurologic ICUs, et cetera, et cetera, et cetera. So there is variance and variability and different capacities of all of those different ICUs. Now, our healthcare system, those 920,000 beds, those 68,000 adult ICU beds, those are really intended for the common conditions we had been addressing pre-pandemic and the common volumes we have been addressing pre-pandemic. What's interesting about the pandemic is we learn more about coronavirus and its impact on individuals. The average length of stay pre-pandemic for folks was in the 4.5 to 5.5 day range. Maine was on the higher end of that at 5.4 days average length of stay for hospital patients. And the average length of stay nationally for ICU patients is 8.25 days. As we learned more about coronavirus, we noticed that the average length of stay for coronavirus patients who don't get admitted to the ICU is between 8 and 9 days. And for those who do get admitted to the ICU, it's about 19 days, meaning that if you have coronavirus, you spend longer in the hospital, on average about 2 times the length of normal patient stays. In the early days of the pandemic, before this most recent wave, hospitals were able to account for this volume because in general, we saw a decrease in all access to the healthcare system. So 911 calls went down, visits to EDs went down, hospital admissions went down, surgeries were decreased. And so we had capacity within our healthcare system, both in the EMS and in the hospital range. But most recently, we've seen this wave starting in July, persisting through now in October. And for instance, the week of September 19th through 25th, there are 123,000 coronavirus patients admitted. And if you look at those numbers and compare that to the 920,000 beds, that means that 13.5% of all hospital beds were taken by COVID patients over that span of the week. Equally, I was been able to find resources that sort of are able to tell us the number of ICU patients. And on September 5th, somewhere around 36% of all ICU beds in the entire country were occupied by patients suffering from COVID. There were over 300,000 admissions for COVID in the month of August, which means that about 37.5% of all hospital beds in the US at one point in time over that month were occupied by patients suffering from COVID. And what I think is important as we think about where we're at right now in the context of this most recent fourth wave resultant from the Delta variant is that this is hit at a very inopportune time as hospitals are seeing previously high numbers of incoming patients who had suffered because they hadn't had access to healthcare for a long time, patients who are injured because of trauma now that they're resuming their normal activities, patients who are now suffering cardiovascular events, who need surgeries, et cetera, et cetera. This is all hitting us as we're also seeing the surge in coronavirus from the Delta variant. As I mentioned, many patients have been lost to healthcare for a while because they haven't been able to access their primary care physicians. We know that over the early period of the pandemic, all screening or most of the screening for cancer got eliminated. And so we're now seeing patients present later in their course of malignancies. And we only wonder the impact on other healthcare conditions, cardiovascular disease, the impacts of diabetes, hypertension, et cetera, have at this point in time. And on top of that, specific to hospitals, with diminution in the ability to discharge patients because of losing long-term care facilities, we're seeing that patients are now staying in hospitals longer. So not only is the length of stay of COVID patients increasing, but the length of stay of all patients is increasing, because in the life of any hospitalized patient, comes a time where they may not need the medical care the hospital provides, but they may need still the nursing care or the rehab care or other care, and they can't necessarily go home because they need that, or they need no more social support. And with lacking services because of shuttering services, decreased beds availability, et cetera, we are seeing patients stay in hospitals much longer. And so this is really occurring it really is a perfect storm that we're seeing happening right now. We're seeing higher than expected volume and acuity than baseline before Delta hit us. We're seeing the surge of the Delta patients and the longer than expected stay because of Delta and because of decreasing availability of long-term care facilities. The hospital's capacities is presently strained at best. And across the country, we're seeing some states have to enact crisis standards of care. I think what this means is that we really need to be protective of our healthcare system, and we really need to be cognizant of the vulnerabilities in our healthcare system right now. Across the US, we've seen tremendously abnormal transfer patterns of patients having to leave one state and go to another state because the first state just doesn't have resources. We're seeing in certain pockets of the country zero ICU bed availability because of coronavirus. And therefore, patients who are very sick, suffering things like intracranial hemorrhages or large vessel occlusive strokes, or patients who have aortic dissection being transported multiple states away. Within our own state, we're receiving patients of that ilk and managing them from remote, while their families stay in very distant areas because they had to be transported for bed capacity. I think it's really important that we, at this very moment, I know this message is old, I know that folks are fatiguing from this, but we really have to dedicate ourselves to maintaining our protective posture right now. We've talked a lot about flattening the curve in the early part of the pandemic, and the whole purpose of flattening the curve was to maintain resiliency of the healthcare system so that we can take care of not only coronavirus patients, but the rest of the patients' needs, patients who don't have coronavirus. And unfortunately, right now, our curve is not flat, and we have to do everything we can to get back to flattening the curve. That means certainly masking. That means masking in stations. That means social distancing when we can, staying outside when we can, hand hygiene. It means screening for PUI symptoms. It means masking all patients. It means wearing a surgical mask on non-PUIs, wearing airborne precautions on PUIs, communicating with the hospital, et cetera, et cetera, et cetera. All those things that we've been talking about since the beginning of the pandemic remain important. Vaccination is a big part of that. Vaccination is a big part of our response to the pandemic, but only one part. And we need to maintain the other protective measures so that we can truly get back to flattening the curve. Our healthcare system is more vulnerable than we all wish it to be. And right now we have to take a very protective posture and do the best we can to prevent surges on the healthcare system and reduction in services. Luckily, Maine is not there yet, but Idaho, Alaska, other states have already had to enact crisis standards of care and considering rationing care. I know this is doubly hard and this is really fatiguing. I know that resiliency is paramount, but also elusive right now. But I come back to my belief that we can get through this if we do it together, we look out for each other and take care of each other. I know that we can make this happen. So with that, I'll pause my slides. Jason, if you want to go ahead back to your slides. Yeah. Jason, do you want to start sharing your slides again?
Yep, I'm just getting them ready. Give me 1 second.
Thank you. We're getting a few items in the chat. I'm seeing one from Michael Barker. Is there any discussion on COVID relief money that the state received to be funneled directly to EMS agencies to support more overtime costs / incentive pay for those that continue to answer the calls? Towns have received money, but the provisions do not allow for using, for using that money if the department is not a municipal department. Since the vaccine mandate was announced, we have lost 6 providers. First and foremost, Michael, thank you. We understand the strain of the mandate, and we understand not only that certainly losing 6 providers is horrible, and I know it's a huge stress. You know, unlike other parts of society and other jobs, I think one of the things that I hold very dear about what we all do is that we certainly have more of a family atmosphere in our work environment. So losing 6 people I know is tremendously stressful, very disruptive to operations. So first and foremost, thanks for attending today, and thanks for sharing that and continuing to answer the call. I'll have to get back to you regarding that, unless any of the staff know if there's been discussion about COVID relief money being funneled to EMS agencies. That's not something that I'm aware of, but I will look into it and we'll get back to you. Staff members online, anything you want to add to that?
Matt, I would suggest that one of the opportunities that agencies have to learn more about opportunities for that will be through the their local EMA offices as that money becomes available and through the local towns. I don't think we're equipped, the staff right now at this point is equipped to handle that discussion to discuss the requirements to get money funneled directly to EMS agencies from the relief money.
John Lennon adds that he is in Albany, New York right now, and the ripple effect or perfect storm is affecting EMS delivery to the ER here in Albany, New York. And he mentions that EMS is waiting on ramps with patients for up to 2 hours. So offload times of 2 hours with non-acute patients until the ER EMS in the doors as beds free up for the EMS patients. John, thanks for sharing that. Luckily, we've not seen that, but we certainly have been hearing similar stories throughout the US. We saw or heard of offload times in excess of 4 hours in Maryland recently, and even longer in other parts of the country. So thanks for your experience. Jason, what's next?
So the discussion about immunization requirements and some of the dates and timelines around the immunization requirements that we had. If you'd like, I could discuss them.
Sure, go ahead.
So we just wanted to take the opportunity to clarify some of the language around the immunization requirements. The Maine EMS emergency rule reads as follows: from October 15th, 2021 through November 21st, 2021, no entity may permit a covered emergency medical services person to provide direct patient care without a certificate of immunization for COVID-19 or a documentation of an exemption. So the history of this goes back to the Maine CDC rule, which they published in August, which had adopted folks need to be fully immunized by October 1st, which would then in turn have meant that an individual working for an EMS entity would have been required to have received their final dose of a vaccine 14 days prior to October 1st. Then Maine EMS adopted their emergency rule, which put the date as at October 15th to provide a certificate of immunization, meaning your vaccination card. And it further goes to state that it has to include the recommended dose of the manufacturer in there as well. But that would make your immunization date, you're fully immunized on October 29th. The governor's office then in turn stated that they would provide discretionary enforcement to the Maine CDC rule in regards to EMS entities after October 29th, which would bring the spirit of their rule in line with the letter of our rule. So those were the dates that were that have been put out there for us. We wanted to make sure everybody was clear on those dates so that there was no opportunity for folks to be confused on those. We are going to be releasing an operational bulletin to touch on this that will be released on Friday. We're waiting to hear back from CDC on any comments they may or may not have on the language of our bulletin and from our commissioner on that bulletin. So the next question was the next slide deck here option is in terms of situational resiliency. And that goes back, Matt, to what you were talking about, our PPE posture and so on and so forth. I think if we've touched on this, we could probably move on.
Great, Jason. We're starting to get a couple other notes in the chat. Ben Wallace asks, is there any progress toward laboratory evidence demonstrating immunity for COVID-19 being suitable? Ben, can you clarify what you mean by being suitable? And then while we're waiting for that, David Groder asked everyone any indication of the number of lost licensed members. So David, great question. This was a point of discussion yesterday at the board. We are trying to clarify that number. Right now, we don't have data that's mature enough to give you a true number. More to come though, because the board is trying to do a survey to figure that number out. And so as we get more information, we will let you know. The difficulty is right now in sharing any numbers. We know that there are individuals who are on the roster of more than one service, in some cases up to multiple services, multiple services. And so the data right now can't necessarily discriminate if a single person who is on 1, 2, or 3 different rosters is being accounted for by each individual agency that they're on the roster for. So we're trying to clarify that, and we'll get back numbers for you. The percent vaccination looks over 90%, but we're again trying to clarify just how much over 90% that number is. And perhaps, I believe at the next time we meet in this forum, we'll be able to give you information there. Seth Ritter helps clarify Ben's question. It says, I'm guessing that Ben is referring to whether demonstrating antibodies might replace a required vaccine. So if that's the case, Ben, what we know about the immunity from active disease is that it's less robust than the immunity achieved from a vaccine. We're also still trying to figure out the durability of that immune response to active disease. And so at this moment in time, the CDC is not necessarily recommending that people who have had disease, the CDC is not recommending that people who prior had disease not get vaccinated. They are actually recommending that those individuals do get vaccinated, as long as they're not manifesting disease immediately. And we know that there's probably about a 3-month window in which you have some significant protection, but beyond that, I'm not certain that we know the durability of the immune response. So I think thank you, Seth, for trying to clarify that. Ben, if that is what you meant, please let us know. Jason, do you want to take the next question? So
from Jeff and Amanda.
Jeff and Amanda, yep.
Yeah. Jeff and Amanda ask, if I understand the dates correctly, then this would mean that non-vaccinated individuals, I'm assuming, would be permitted to work up until October 29th. Is that correct? Jeff, that is not correct. Individuals have to provide a certificate of immunization by October 15th. So they would have had to have received a single dose of J&J on October 15th, or have received their final dose of either the Pfizer or Moderna vaccination on October 15th to be able to continue working.
I think the nuance that we can all think about is that the deadline, the October 29th deadline, is the deadline for protection. And because it takes 2 weeks to achieve protection from your last dose of vaccination, that would mean the last dose of vaccination must be delivered by the 15th. Maybe that helps clarify this to some extent. Ben did get back to us. Thank you, Ben. He says currently the CDC rule doesn't allow that in place of vaccination. I think you mean doesn't allow recent or prior infection in place of vaccination. I know that there wasn't previous consensus on what the testing really meant when determining if someone had demonstrated immunity. Yeah, so as I mentioned, the durability of the protection from infection is shorter lived than the durability from protection with vaccination. In fact, the immune response is greater in vaccinated individuals than infected individuals. And so that's why the CDC is recommending that everyone get vaccinated, and that's why vaccination is the focus of the mandate. Seth adds, natural immunity to COVID is short-lived, being protective for a couple months in most cases. Yeah, thanks for this, Seth. The greatest antibody response was seen in people who had COVID and then received vaccination. But vaccination really is the cornerstone here. Fred Porter asks, what is the status on drivers that do not provide care? I asked this before, but wondering, Jason, do you want to tackle that one?
Sure. So Fred, thank you for that question. I hope everything's going really good out on the island for you today. The question about drivers is a good question. So that's going to refer to the any individual that is involved in direct patient care, and that's defined as any activity that puts you within 6 feet of the patient for a duration of greater than 15 minutes. So if your folks that are driving don't help get the patient ready to load into the ambulance, don't help load them into the ambulance, don't help get them situated in the back of the ambulance before departing the scene, then and they sit farther than 6 feet away from the patient with a barrier between them, then they would not be required to be immunized. But other than that, it's a good question, and it's um, slightly up for some interpretation by the EMS agency and those clinicians, but uh, you have to apply your own straight face test to that.
So that gets us to Michael Barker, who who clarifies in the number of individuals they lost. Thanks for this, Michael. Says that some of the people that we have lost were fully vaccinated, but then decided to leave Maine for work in New Hampshire, where there was no mandate. Just for clarification, it's not just because they were not vaccinated. FYI for the numbers. Thanks for that clarification, Michael. Josh Allen asks, will October 15th also be the start of pre-shift screening for those with medical exemptions, i.e. for those who haven't been vaccinated? Honestly, Josh, I think that it's probably wise to be starting any of those things now, to be honest with you. I think folks who have a legitimate medical exemption from the vaccine are more vulnerable than folks who have received the vaccine. And it's probably reasonable to start those screenings ASAP. As far as a drop deadline, I don't know that I've heard any discussions about that. If any other staff have anything to add to this, but honestly, Josh, I would consider those folks more vulnerable than the rest of your workforce, and I would urge you to consider the pre-shift screening ASAP in those cases. Jason, Darren,
I think
Melissa,
he might be
anyone else?
talking about the testing requirement, because there's a testing requirement.
The
in the
testing
rules
requirement
for those who have a medical exemption. So I would that will start on October 15th as well.
Okay, Fred, sorry, Josh, I thought you meant screening for symptoms, which again, we should be doing as of now. Fred adds, thanks. Jeff asks, has Maine EMS done any research on the effect or loss of I believe it's non-licensed support staff that will be unable to assist and or drive an ambulance? Thanks for that question, Jeff. Again, this was taken up as a point of discussion at the Maine EMS board yesterday, and yes, we are looking into that. We know that there are about 5,147 individuals, both licensed and non-licensed, who are identified as having direct patient contact. And we are trying to determine, of that 5,147 folks who have direct patient contact, what the impact is from the vaccination. And because the way because people can practice for more than one service, and because the way that the data was delivered, there is some redundancy, we know, in the numbers. And so we're trying to work through that redundancy with follow-up surveys. So more to come on that, and we will definitely share that with everyone as we understand the impact of the mandate. Stephen Leach asks, wouldn't the DHHS rule prohibit any unvaccinated drivers from being involved with an EMS response? So our specific rule, as Jason mentioned, references direct patient contact, which is defined as within 6 feet 15 minutes or more. And it doesn't have to be 15 contiguous minutes, it's a combined contact time of 15 minutes. So that's how we're defining direct patient contact. So Steve, there is some local application to that, as Jason mentioned. I think in most cases, we would acknowledge that drivers are involved in direct patient contact based on that definition. So in most cases, you're correct about that.
And Matt, he is absolutely correct on the DHHS's emergency rule in regards to the emergency rule cites any employee of the entity. However, the Maine EMS rule doesn't go that far.
Thank you for that, Jason. David Hanscom asks or mentions, it was my understanding that the rule prohibited involvement and even prohibited subcontractors who are not vaccinated for coming into our stations. Jason, you want to tackle that one?
I'm not sure on that one. Our rule doesn't talk about that, but the DHHS rule did talk about subcontractors being identified as employees of the entity. And that is part of their emergency rule. But I don't know if it prohibits them from coming into your stations. I don't know that. Like, you'd have to seek clarification from DHHS on that question.
So Josh confirms he was talking about the Binex test. Thanks for that confirmation, Josh. And thanks for acknowledging the pre-shift screening for symptoms. David asks, which rule is the governing rule, DHHS or MEMS?
So
Jason, do you want to tackle that one?
absolutely. DHHS released an FAQ document, which in which they said, and it's available on their website, and there's going to be a link to it and a quote from it in the operational bulletin that we're going to send out on Friday. That says, let me find it. To the extent that there is any inconsistency, DHHS will use its enforcement discretion to align its emergency rules definitions with the Board of Emergency Medical Services emergency rules definitions. So I hope that provides some clarification, Dave. The reason Maine EMS is putting out a rule is because we are the regulatory agency that has oversight over EMS clinicians and EMS agencies. So we're publishing a rule so that we can establish the ground floor for what is expected of our regulated community. Our rule, when we get to the nuts and bolts of how things work, our rule doesn't affect the DHS rule, and their rule doesn't affect our rule. Our rule is intended to let, like, as I said, let our regulated community understand what our expectation is of them. So Matt, we do have someone with us today, and I apologize if I get her name incorrectly, but Yamaya St. Clair is here with us today from the Northern Light EAP program that Sam had requested her to come and to discuss with us some mental health resources. So if she's available to speak now, I'll stop sharing my screen for a second and ask her to turn her video on and introduce herself and go from there.
Great, thank you so much. I really appreciate being invited to join you all and recognize the immense stress that that you and your teams must be under, given the realities of all your handling. So my name is Yamaya St. Clair. You did not butcher my name. You did a wonderful job. And I am with the EAP program, the Employee Assistance Program for Northern Light Health, including Northern Lights ambulance services, EMS services, and we have also 90 other client companies and municipalities around the state that we support And we are fortunate to have partnered with the state of Maine to extend our services to all healthcare workers, which fortunately the state is including all EMS providers around the state in that category to be able to offer free support services to everyone who may need and want to access some additional support. I'll go ahead and share my screen if that's okay, and just show you the website that we have going that shows the various supports available. So you can see here, hopefully, that this is an opportunity to get some additional services. We have individual work-life coaching as one of our primary elements. This is in confidential one-on-one coaching with a licensed mental health counselor who does have experience working with individuals in the EMS community. And these are, it says up to 12 here, we need to edit this, but up to 6 50-minute sessions conducted via Zoom. We know that a lot of people are really concerned about confidentiality, and I just want to assure everyone that even though we're affiliated with Northern Light Health, we have a separate database system for taking any of our notes. We keep very little notes. We don't do diagnosis or treatment planning. We're more of a short-term way to access free and confidential support and coaching. But none of our information regarding kind of individual confidential information is shared with Northern Light Health or with any other entity. We take it very seriously. We have an office in Bangor and one in Portland, and we're a small committed team and really want to be able to offer these kinds of supports to you and your teams. So individual work-life coaching is one element of what we offer. We also have a lot of wellness workshops on a range of topics, and some wellness and connection group support. So these are more peer connection, small closed group of 6 to 10 members focusing on stress management. And we're in the process of getting those up and running. And we, all of these services, fortunately, we are able to really customize to meet the needs of particular groups. So if you, if you're a leader of an entity that wants me to pop on and just introduce myself and these services to an upcoming staff meeting, oftentimes that kind of warm handoff is helpful for people rather than just giving them an 800 number to call. And if you wanted to customize a group service or training for your team, that is something we could definitely do. At the moment, we have these funds available to us through May of 2022. So we have some time, and there's potentially additional funding sources to allow that to continue into the future. We offer a lot of trainings on a range of topics, and everything from stress management and resiliency strategies to professional communication, professional boundaries, de-escalation strategies, which I know is something you all I imagine are great experts in. Managing time and task. I'm just looking up at our training menu here. Skills for new supervisors, training on sustaining compassion, or that whole compassion fatigue and burnout. So lots of different options there, as well as leadership consultations we do. It's hard to be at the top in an organization often and have to carry and hold all the things that you do, as well as manage your own personal and professional issues. So it can be helpful to talk to someone a bit removed and just talk through it a bit. What else do I have to add about this? Just again, we really want to make these services fit people's needs and meet people where they are. So if you're not seeing something up here that you know would be helpful for your team, we do other things like critical incident debriefs, and really do focus on that psychological first aid model. We'd be happy to talk about how to best work with your team. So please don't hesitate to reach out. I'll put in the chat function our information about how to contact us to set up any sort of services that may be helpful for your groups. And just recognizing stressors are huge, and people have a need to get some additional support, and we want to make sure that's available to you. Any questions?
Yamina, thank you very much. If folks were interested in taking advantage of your services, that 1-800 number that was on the website, the workforce.northernlight.org, is that the way to reach you?
Yeah, I'll put in the chat function. Our 1-800 number is probably the most effective
Great.
way. It is an 800 number, but again, it goes to our Bangor or Portland office and to one of us. And we are quick and responsive. We have a 24/7 phone line as well. We are also overseeing the Maine Frontline Warm Line, which maybe some of you are familiar with. That's now coming through to our number, and we have after our call center as well that has an escalation kind of clause. So if there is someone in great distress, it will come to one of us, even off regular business hours. So that 1-800 number is the best way to reach us. And I'll also put our email address. That is another way if you want to try to coordinate, scheduling some services or trainings or workshops, or we do small group debriefs. Just getting people together and just saying, how we doing can be helpful every once in a while.
Thank you again. This is a great offering, and thanks for being present and helping with everything.
Yeah, great. And I guess the only last thing I'll say is just reiterating that piece about happy to come on and pop onto a meeting for just even a few minutes if it would be helpful for any of your individual entities.
Thank you. I think we have a couple more comments and questions in the chat function. Ben Wallace mentions, I'd just like to say that even if someone works for more than one service, their loss due to non-compliance with a mandate is still a direct operational loss to each service. Absolutely, Ben, I completely agree with you. In fact, I would add, I may have mentioned this earlier, but I think that any loss to in any service of any size is significant. The reality is that, like I said earlier, we're a little different than other parts of the workforce in which we're much more family oriented, much more kind of close knit. And so any loss of members is devastating, both emotionally and logistically. And so, it's not like we can necessarily always just find someone and plug them immediately into service. There's a training requirement commonly for a new community, et cetera, et cetera. So yes, I completely agree with you about that. And that one loss can affect multiple services, certainly. Jeff asks, is there a plan in place at the state level in the event communities or sections of the state are unable to staff ambulances if situations worsen? So Jeff, there was some discussion and dialogue about this at the level of Maine EMS. Again, we're trying to identify services based on the survey results that are that appear, based on the survey at least, to have higher levels of vulnerability, and then reach out with some strategies proactively to help them maintain response within their communities. So more to come on that.
Matt.
Yes, Jason, please.
Matt, one of the things that I would say in regards to that is that so one of the challenges that we have at Maine EMS is that we don't have an operational branch here. We work closely with our regional partners to reach down to local agencies. We are talking at the state office about putting together some thoughts and some suggestions for services that may be facing staffing challenges, and work on that is in progress and has not yet been finalized. But in the meantime, the folks that have the best situational awareness of their current situation are those local agencies. So the one piece of advice that we can give to these agencies is to open up their channels of communications to their local partners, right? Communicate with your local hospitals, communicate with your neighboring EMS agencies as to your staffing capabilities, and communicate with the regional office as well, as far as your staffing capabilities go. We're available here as a resource in Maine EMS if you need help figuring something out. We can't specifically do it for you, but we can sort of steer you in the right direction if that case may arise, and maybe not in all situations, right? we do realize that there may be that there is a tough road ahead of us. Not that there may be, but there is a tough road ahead of us. Um, but we don't have our head in the sand here. We're in tune to your situation, and we want to help as much as we can. Right now, the best thing that you can do is communicate, communicate with all of your partners effectively.
Thanks for that, Jason. Perhaps, I don't know if you're the most appropriate to answer the next question, but Lori Rice asks, my agency is multifaceted. We are not only an EMS agency, we are a licensed training center, provide wheelchair transport, and have on-site dispatching. So is my entire agency covered by the EMS rule, or should I be following the governor's rule instead?
Well, Lori, I can't provide you the guidance on that. I would say that you absolutely need to follow the Maine EMS rule. But different services will also have different requirements based on the type of service that they are. Um, that they'll have different folks that they have to comply with. Um, I think we can help take this conversation offline a little bit too, Lori, to maybe get you a better answer. But in terms of guidance, I can only offer guidance on the Maine EMS rule, and I would say that at a minimum should be the one that you should follow.
The next item in the chat, again, thanks to Yamena and her workforce EAP program, Northern Light, the state of Maine, for all their assistance. She's added her contact information in the chat for folks. It looks like you can email, you can either write down the 1-800 number or email strengthenme@northernlight.org, and ME is capitalized as in Maine. Jeff, you're welcome. Thank you for all your questions as well. Joe asks, where can we find a rule on the vaccination status deadline in written form? Jason, do you have a quick link that you can put in the text in the chat regarding that?
I can't put that right in the chat for you.
Do we have any questions coming in over the text line at all?
Why did that slide show an end date? Oh, so there is one question in the chat that says, why did the slide show an end date? The end date in that rule is because that is an emergency rule. And that emergency rule is valid for 90 days after the adoption. And the rule expires on November 23rd. And when the rule was written, November 21st was the 90-day mark after the adoption.
While Jason's finding that that link to the rule, any other questions folks have? The fire chief from the town of Algonquin asks, the final rule will do away with that end date. Yes, so the Maine EMS board passed an emergency rule to address the immediate need. That emergency rule is valid for 90 days. The Maine EMS board is talking about the permanent rule that will take place, will take the place of that emergency rule, and that will perpetuate. Please expect to hear more about, like any other rule, it will require hearings. Please expect more to hear about both the final language of the rule as well as the dates of those hearings, so for public comments, but more to come from that in the very near future, because that rule needs to be in place and passed by the November end date. So thanks for that. Thanks for that question, Chief. Jason, any luck on finding that link?
I'm going to put the document right in the chat. I don't see if it allows me to. I don't see where it is on our website, which is slightly embarrassing to me, but we will resolve that today.
Jason,
And
it is posted
yes.
in the latest news, right
Oh,
on
okay.
the homepage of the Maine EMS website. It was posted there August 26th. That's where you'll find the link.
Thank you, Melissa. Oh, there it is. In the chat.
Great, thank you for that. Steve Leach asks, is there a draft of that available yet? I think, Steve, you're referencing the draft of the rule. The answer is almost. The rules subcommittee is working on that, and there will be one forthcoming. I don't know exactly when it will come, but yes, there will be one forthcoming that will be made available before all those hearings. So more to come on that very shortly.
Yeah,
Thanks for that question, Steve.
The board voted to go to the official rulemaking process yesterday with two rules, I believe. So we will have those published shortly.
Any final questions from folks? Well, seeing none, as always, we want to thank everyone and appreciate everyone for showing up today. I think I saw our numbers much higher than 67 at one point in time. We are grateful for your continued attention to these subjects. We are thankful for your questions and clarifying some of the rules that are being promulgated right now, and very grateful for you and asking those questions. Please take care of each other, look out for each other, reach out to each other. Please consider the services, the Warm Line Frontline, the EAP services that Yamina St. Clair mentioned, the Strengthen Me at northernlight.org opportunity, the 800 number that she mentioned if you're looking for personal or if you're looking for help personally or you want to access them for your service, please consider doing so. As always, between now and the next time we meet, if there are any questions that arise, any concerns, any clarification need, please reach out to Maine EMS. We're here to help. We look forward to helping in any way we can, and look forward to seeing you the next time we meet. Thanks everyone very much.